Hi, thank you so much for being here today. I actually pre-recorded my presentation to make sure I get to everything I wanted to. So I'll share my screen, and after watching it, if you have any questions, I'll be more than happy to answer them. Just let me know if you can hear it. Hi, everyone, and welcome. I'm Yael Hallak, and I'm really glad to be here with you today. I had the privilege of receiving the Professional Development Award, which I used to take a course with Professor Bill Miller, who developed motivational interviewing. What I'll be sharing today are some of the most practical tools and insights I took from that experience. And I hope you'll feel ready to try these ideas as soon as this meeting ends, whether with your clients or in your own life. So, what is motivational interviewing and why use it? Over the past year, I've been interning at a substance use treatment facility, working with people trying to change their relationship with drugs or alcohol. And one thing I've seen over and over again is the internal conflict. Part of me wants to stop, but another part of me still needs it or isn't ready to let go. It's not a simple yes or no. It's more like a conversation between competing needs and voices inside. And that experience is actually very human. For me, it might show up on a regular morning when my alarm goes off. I know I want to get up and start the day with energy and purpose. But another part of me just wants to pull the blanket over my head. That quiet negotiation between short term comfort and long term intention, that's something motivational interviewing helps us listen to, work with, and eventually, even without knowing you personally, I can guess something about you. Inside you, there is a smart, educated, caring voice. That part of you knows what's right for you, for your kids, for your partner, maybe even for your clients. That voice is informed by years of learning, training, and life experience, and it wants to help. But here is the thing, even when our intentions are good, and especially when we're trying to help someone we care about, our well meaning advice doesn't always land the way we hope. For example, let's say you and I are out to lunch. We sit down, look at the menu. You decide to order a burger and fries. And just as you do, I gently lean over and say, "Are you sure? Didn't you say yesterday that you were trying to lose those 5 pounds from spring break?" I didn't raise my voice. I wasn't rude. I just made a suggestion, coming from a place of concern. But let's be honest. How would that feel? Would you feel more empowered, more confident, or maybe a little judged? And more importantly, did I just increase or decrease the chances that you'll actually go with the salad? Usually, when we receive any kind of feedback, we tend to interrupt it as judgment, which often triggers feelings of shame or guilt. Our automatic response is to protect ourselves, either by withdrawing and pulling back, or by becoming defensive and attacking. This raises an important question. How can we move away from giving advice and instead focus on strengthening the internal motivation of the person we are speaking with? When we talk about addiction, it's important to remember it exists on a spectrum. As clinicians, we often need to draw a clear line for diagnostic or insurance purposes. But real life isn't so black and white. It's like high blood pressure. Crossing 140 doesn't mean your health suddenly changes. It's a gradual process, and the same is true for addiction. A question that can help us better understand the person in front of us is this: Who is really in control? Are they choosing to check their phone hundreds of times a day? Or has it become automatic, something they do without thinking? Are they deciding what and when to eat? Or are their cravings calling the shots? These aren't just small questions, they get at something deeper. Because whether it's alcohol, food, screens, or substances, the main issue isn't always whether it meets the criteria for diagnosis. It's about how much space the behavior takes up in someone's life and what it might be pushing out. One of the biggest reasons change is so difficult is ambivalence. That inner experience of being pulled in two directions at once. You want to change and you don't want to change. This isn't a sign of failure or denial. It's a normal and expected part of the change process. In the language of internal family systems, ambivalence reflects the fact that we're made up of different parts, each with its own perspective, fear, or need. For example, one part might be a manager, tired of what drinking is doing to your life, longing for stability, health, and a sense of self worth. It wants control, order, and a better future. But another part might be a firefighter, a part that jumps in when emotional pain starts to surface. It may reach for alcohol to soothe, numb, or distract from that pain. That part is reactive, urgent, and focused on release. And often, beneath both of these is an exile, a younger, more vulnerable part, carrying deep feelings of loneliness, shame, or fear. These are the parts we often try not to feel, but they're very much present, and they're the reason the other parts have developed their protective strategies. None of these parts are bad. They formed for a reason. They've been trying to help us survive, each in their own way. And again, you can see the same inner conflict in more everyday behaviors too. Take scrolling on your phone late at night. One part of you might say, I really need to sleep. I have an early meeting tomorrow. Another part might say, this is the only time I get to unwind. I deserve this break. So you scroll, even while feeling guilty. That's ambivalence. Parts with different needs, both trying to protect you or meet something essential. What motivational interviewing offers is a way to make space for these parts to be heard. When we try to pressure someone into change, the protective parts often push back. But when we invite a person to speak from both sides with safety and curiosity, they often begin to hear themselves differently. That's where movement starts to happen. When we think about change, especially big, meaningful change, it's easy to imagine it as a single decision, a moment of transformation. But in reality, change is almost always a process, not an event. And it tends to unfold in stages, gradually, often with a few detours along the way. The model we use to understand this is called stages of change, and it includes five main stages: pre-contemplation, contemplation, preparation, action, and maintenance. We also recognize that relapse is a common and natural part of the process. It doesn't mean failure, it just means the person may circle back to an earlier stage before moving forward again. Think of this model not as a straight line, but more like a spiral. People move forward, slip back, loop around, and that's normal. Real change is rarely neat. Let's quickly walk through what each stage looks like. Pre-contemplation is the what problem stage? The person doesn't see a need for change yet, or they feel resistance to the idea. At this stage, the person isn't thinking about change. Maybe they don't see their behavior as a problem. or maybe they've just lost hope. If we push too hard here, we usually get resistance. So, what do we do instead? We use reflective listening and gentle discrepancy. We might say something like, "You're not really seeing your drinking as a problem. And at the same time, you mentioned your blood pressure has been high. I wonder if there could be a connection." We're not trying to convince them. We're just starting a conversation and gently raising awareness. Contemplation is when they begin to consider change but feel torn. They see the pros and cons and aren't sure what to do. Now they're on the fence. They're starting to see the downsides of the behavior, but they also see the benefits. They might say, "I know I should quit, but it helps me with my stress." This is where ambivalence lives, and motivational interviewing is designed for exactly this moment. At this point, we can use decisional balance. Ask, what do you like about the behavior? And what are the not so great parts? We let both voices speak. The goal isn't to argue, it's to evoke their own reasons for change because people don't resist their own ideas. Preparation is the planning stage. The person is getting ready, maybe setting a goal, doing research. Now they've decided, they are making a plan. Maybe they've set a quit date or they are reaching out for support. This is the moment to help them translate intention into action. We can use the elicit, provide elicit technique. We might ask, would you like to hear some things that have helped others? Then share a few ideas, like removing triggers or writing down the reasons for change. And ask, what sounds like it might work for you? We stay collaborative. The plan has to come from them, not from us. Action is where they're actively changing their behavior. They're actively making changes. Maybe they've stopped using or they're going to therapy. This is where change becomes visible, but it's also where relapse risk is high. The motivational interviewing technique we would use is affirm and troubleshoot. We affirm their effort. You've been clean for 2 weeks. That's a huge deal. And we ask, what's been the hardest part? What's helped you get through it? We normalize the struggle and help them adjust the plan as needed. Maintenance is about sustaining those changes and managing setbacks. And of course, relapse might show up anywhere along the way. Here, the person has made the change and is trying to sustain it. The crisis may be over, but the work continues. At this point, we should plan for high risk moments. We ask, what situations still make you feel vulnerable? What's your plan if those come up? And if they do relapse, we don't shame them. Instead, we say, what happened? What did you learn? And how can we use that to move forward? We treat relapse as data, not disaster. The key insight of this model is that different stages call for different types of support. What works in one stage may not work or may even backfire in another. For instance, trying to get someone to commit to action when they're still in pre-contemplation is likely to fail flat. They're not resistant, they're just not ready yet. That's where motivational interviewing comes in. Motivational interviewing helps us meet people exactly where they are, especially in the early stages when ambivalence is high and readiness is low. We don't push, we don't lecture. Instead, we create a space where all parts of the person can speak, especially the conflicted one. I hope these techniques sound useful, like something you'd like to try out with your clients or even in your own life. But hey, do we actually have proof that it works? The answer is yes. Motivational interviewing is one of the most well-researched counseling methods out there. Over 200 randomized controlled trials have shown that motivational interviewing helps people reduce substance use, stick with treatment, and make meaningful changes in all kinds of areas: smoking, diet, exercise, medication adherence, and more. It works across different settings and with all kinds of people. And the best part, it's surprisingly learnable. You don't need years of training to start using it. Even just practicing a few core techniques like reflective listening or asking permission before offering advice can make a real difference in how someone responds. Motivational interviewing also tends to work especially well when people feel stuck or ambivalent, which is often the situation of the people we're trying to help. And why does it work? Because it helps people hear themselves say what matters to them. Motivational interviewing increases what we call change talk. And we know from research that the more someone argues for change in their own words, the more likely they are to actually follow through. Thank you so much. Thank you for listening. I hope you leave today not just with tools, but with a deeper sense of how small shifts in the way we listen can open the door to real change for our clients and for ourselves.
That was awesome. Thank you so much for your presentation. So now at this point, we're going to open the floor for anybody who might have some questions.
Yes, go ahead.
Yeah, thank you. I thought that was a really well put together talk, and it also looked beautiful. So yeah, really clear and well paced. So thank you. I was wondering, yeah, how you use this in your own work, and then whether this is an approach that really works well for all populations, or ever requires any kind of cultural adaptation for different groups.
I lost my connection for a second there, but I think I understood your question. So there was actually research done about cultural aspects, and the method works with different cultures and with different populations and across different ages. Um, I think there has been a little bit of research showing that some populations actually feel less secure when being listened to, which is a bit counterintuitive. But there was research that showed that, and yes, it is something to consider.
Mhm. Yeah, and the first question was how you use it in your own work, with what populations and for what outcomes.
I'm sorry, could you please repeat the question? My connection is not stable.
Oh, sorry. Yeah, it might be my connection. What populations you work with motivational interviewing and what your experience of it has been?
For the past year, I've been an intern at a substance abuse facility in New Jersey.
Uh-huh. And you found it works well.
Yes, I find it works really well, both for me and usually with substance abuse clients, there is a lot of work done in groups. And because it's such a easy to teach method, I find it also works really well when clients cooperate and listen to each other and trying to utilize motivational interviewing among themselves.
Oh, great. Yeah, thank you.
Thank you. Yes, Jordan.
Hi, thank you for the presentation. It was great. I'm taking a substance use class right now, and we're learning about motivational interviewing. So I wanted to come to this to see if I can learn some of the same things. And it was nice to see how some of your content was like echoed in my class too. And I'm wondering, like, can you apply motivational interviewing to other disorders like MDD or like situations where people have to do some type of behavior change, like if someone was struggling with depression and just like getting them to do like things around the house, can you apply like the states of change and motivational interviewing for other disorders like that?
Yes, thank you for the feedback. And I think this is very relevant. As I said in the presentation, both in our lives and like in everyday life, and with people with depression and other conditions. Um, I think that the main difference between motivational interviewing and just the human center approach or Roger's kind of listening is that motivational interviewing does offer a direction. We are not pushing the client in any way, but we are enhancing change talk, and we are providing an opportunity for the client to hear themselves and encourage themselves to take action and to move forward and take steps. So I definitely think, and there is research, there is evidence in research showing that it might be helpful in conditions like depression.